In this video, we will go over the symptoms and causes of TMD, which is the disorder of the jaw joint, otherwise known as the temporal mandibular joint, and also referred to as TMJ or TMD. This is one of 3 videos on TMD, and this information will make most sense if you watch those other videos as well. I'm Rick Buck, and I've been a dentist for 15 years, so like and subscribe if you have teeth. TMD is kind of a funny term. It stands for temporal mandibular disorder, which tells you almost nothing about the condition, actually. It'd be like going to a doctor for back pain and them saying your diagnosis is back problems. If a doctor told you this, you would be like, okay, what is my back problem? Is my spine not aligned? Why is it not aligned? Is there a pinched nerve? Are certain back muscles overactive or fatigued? Am I sleeping wrong? Did trauma cause this? You get the picture. Well, like your back, the jaw is a very complex joint. So as with most pain and disorders, to cover TMD, you need to look at 4 things: the symptoms, the mechanisms or pathways that are causing those symptoms, the triggers setting off the mechanisms, and then the remedies to those triggers or mechanisms or symptoms, or however you want to do that. To vividly illustrate what I mean, if you were choking, a symptom would be turning blue in the face. The mechanism causing your face to turn blue would be the lack of oxygen to the lungs and the blood. The trigger setting off that mechanism would be the candy or food that's lodged in the trachea that prevents breathing. The remedy to the root cause would be performing the Heimlich or just coughing up whatever's lodged in your trachea. So if you just wanted to treat the symptom of turning blue in the face, you can simply put on makeup while your face is turning blue and your skin will appear a better, more normal color. But that obviously won't help the root cause and you'll probably die. Now, treating the mechanism of the lack of oxygen, you could administer oxygen, but we know that will do nothing because your trachea is blocked off, and so you can't fix the main issue that way. You could also treat the mechanism by doing a tracheotomy or putting a hole in your trachea so that you can breathe through that way. But wouldn't you want someone to try the Heimlich first before they went on to that? In this video, we will go over the many different symptoms of TMJ, then the mechanisms that cause those symptoms. In the next videos, we'll cover the triggers of those mechanisms and then the remedies. Let's get started by quickly listing off the main symptoms you can expect with TMD, and then I will explain how these apply to the various causes or mechanisms. Now, the thing with symptoms, as with any disorder in your body, is you'll have some of these, but then you won't have others. And it's also possible to have some of these symptoms and your issue is not related to TMD at all. So make note of yours, and here they are. First, jaw popping when opening your mouth is the most common and obvious symptom of TMD, but it doesn't necessarily mean you have TMD if you have popping. Next, like jaw popping and is a less common symptom, is called crepitus. Crepitus is tiny grinding, creaking, cracking, grating, crunching, or popping sounds when moving and opening and closing your jaw. Pain or fatigue in the jaw muscles is another symptom of TMJ. And just so you know, your main jaw muscles are between your cheek and your ear, and they're also by your temples on the side of your head just above your ear. So the next symptoms are frequent headaches. Actually, oftentimes those headaches will be around where those jaw muscles are on the side of your head and kind of above your ear. Next, worn down teeth and a flattened biting surface of your teeth, or many cracked and broken teeth, are other indicators of TMD. What might seem funny and a lot of people don't know is that random hearing issues like tinnitus and earaches could also be related to TMJ. Not all of them are related to TMJ, but some of them could be. A very limited opening of the jaw is another symptom of TMD as well as locking of the jaw could be a symptom of TMD. Pain when chewing could possibly be a sign of TMJ, or even seemingly spontaneous aching of the teeth without chewing could be a sign of TMD. Very pronounced jaw muscles are a sign of TMD, especially muscles close to the corners of your jaw. This can be easily seen for some people when they clench their teeth. Pain in other muscles of the neck, upper back, face, behind the eyes, shoulders, and back of the head are also signs and symptoms of TMD. Tori, which is an extra bone growth in the mandible or lower jaw, can be more pronounced and correlated in people with TMD. But you must note that you can have tori without TMD. It just seems to be more common that people have pronounced tori or extra bone growth in people with TMD. The feeling that your bite is suddenly off or uneven is a symptom that a lot of people get with TMD as well. And the last of the symptoms before we go on to what is causing them, but certainly not the least, is clenching and grinding of the teeth. It should be noted that clenching is both a symptom and a trigger that we will get into later in another video. Now, I will show you how these symptoms are happening. But before I can help you understand what is causing these symptoms and getting into the mechanisms, I want to plug my video about the best daily brushing and flossing routine. It will show you how to optimally take care of your teeth with all the best products that I have tested out in other videos that I've made. These products include my favorite floss, toothbrush, and toothpaste by far, and those videos go over the best techniques on how to brush and floss. But you can see why they are my favorite with the stunning results in a video that pops up at the end of this video. Okay, now you will see that certain mechanisms have pathways that more commonly lead to a set of some of those symptoms we just explained. Hopefully, this will help you and your dentist narrow down what is going on specifically with you. It should be noted that multiple mechanisms can and likely will be happening at the same time if you have TMD. Let's start with the mechanism of overused muscles, which is normally caused from the clenching of the jaw muscles. Overusing any muscle can cause fatigue and pain and inflammation in the muscle. While jaw pain and inflammation are separate, for the purposes of this video, we will cover the inflamed and tender muscles of the jaw together. Some studies suggest that 85% of TMD issues are related to the muscles. When muscles are overused, they can become very sore, inflamed, irritated, and tender. How does this relate to your pain? Nerves do not like inflammation. It literally messes up their flow, and they easily become triggered to even a normal stimulus. Like if you just touch a sore muscle at a normal pressure, it will set them off. Well, you have nerves running everywhere and all throughout your body and branching back and forth. In fact, you have nerves connected to your jaw muscles and running along these muscles as well. So if muscles become inflamed, they will become sore and tender to the touch, or even painful when opening and closing your mouth, which includes chewing or even talking a normal amount. But here is where it gets interesting and confusing to some dentists and doctors. Because of the branching of your nerves, they can give signals so you can feel muscle pain somewhere else besides the actual location of the pain. I know that may sound confusing, but stick with me. Because of this, sometimes you will even feel jaw muscle pain in your teeth. In fact, it gets so odd and complex that you can remove the tooth and still feel pain in the tooth that isn't even there. There are people that will have teeth removed or root canals because they swear they can feel the pain in the tooth when really the source of the pain is the muscle. And this is one other reason your teeth might ache due to clenching, but we will get into some of the more normal causes later. This diagram shows which muscles are more commonly wired to refer pain to a specific tooth. And you can see which muscle and which part of the muscle might be referring pain to which teeth. Actually, sometimes if you find a spot on the muscle causing the referred pain, you can press on it and you'll feel the pain radiate to the tooth, if you're lucky. This condition actually has a name and is called myofascial pain syndrome. Moving on, when muscles are overused, they become pronounced and hard when you feel them clench. While you may want this for your biceps, normally people don't want it for their jaw. But you can be sure overused and inflamed jaw muscles are more pronounced when flexing and chewing and clenching. Clench your teeth and feel this area. If it flexes a lot, this is a common sign for people with TMD due to too much clenching. Basically, you've been overworking that muscle and it's now buff. Okay, moving on to another mechanism of clenching. Our bodies, you see, are amazing in that they will compensate for weakness so things can operate even when you have an injury. Well, if we fatigue our jaw muscles, other muscles will start to compensate, and they too can become fatigued if they have to do it too much. Thus, you can start getting pain in muscles that seemingly have little to do with chewing. These include pain in your neck, upper back, shoulders, back of your eyes, and the back of your head. For each person, it is different which muscles will start to become fatigued because they're trying to compensate. But this can happen in reverse too. So let's say you overuse your neck muscles and they become fatigued, your jaw muscles can start to try and compensate for their fatigue. So it's the same in reverse. Either way, the end result is all the muscles in the neck and head become worn out, tired, sore, and inflamed. In my next video, we will get more into clenching because it is what will trigger the jaw pain too. But Clenching is definitely also a sign of TMD. Because your jaw, for some reason, is sensitive to hormonal and mineral imbalances in your body, and when it senses an imbalance with some things, it will start to clench a lot. We'll go more into what causes the imbalances in the following videos. For now, it's just important to know if your body is sensing some sort of imbalance, sometimes it will send signals that it needs to clench more. Then you may catch yourself clenching at random times during the day, or a partner may wake you up in the night to tell you that you're grinding or clenching your teeth. But that's just if you're clenching excessively. The truth is, almost everyone clenches their teeth at least a little at night. Some do it more than others, and sometimes in your life, you'll do it more than at other points in your life. You may even wake up with sore jaw muscles because of it. The question for TMJ is, what causes the muscles suddenly to clench excessively? Watch my video on TMJ triggers for more on that. Either way, if you're overworking the jaw muscles because of clenching, over a long period of time, you will likely have worn down teeth, fractured teeth due to the constant excessive pressure. Also, some people may have noticed they have extra bone lumps or nodules around their gums, or at least that they're getting bigger. This is called tori, and it is normal. However, people that clench their teeth are more likely to have excessive tori, though it is possible to have a lot of tori without clenching and grinding. It's just that there is a little bit of a correlation there. The final symptom you are likely to experience with overworked jaw muscles before we get into other mechanisms is headaches. On the side of your head, in the area above your ear, you actually have muscles that contribute to closing your jaw. It may seem funny to have muscles all the way up there controlling your jaw, but you do. If those muscles become sore, you can start to get headaches. This is one of the reasons if you massage the jaw muscles on the side of your head, called your temporalis, it may help relieve your headaches. Okay, we are done explaining the pathway of your symptoms due to overused jaw muscles. The other mechanisms causing your TMD won't take as much of an explanation. But now let's move on to the temporomandibular joint itself instead of the muscles. You have a socket in your skull that your jaw fits into and hinges on. When you open, the jaw rotates in that socket until a certain point. When you open wider than that point, the jaw slides forward and out of that socket a little bit. Well, you see, there's a capsule and disc between the jawbone and socket that keeps everything in that joint running smoothly. However, for some people, it doesn't run smoothly. For them, when you open wide enough, the jaw moves forward and it will dislodge the disc and then move forward. The dislodging of that disc is the next mechanism that will cause a set of symptoms. The first and most obvious symptom is the popping feeling or even sound that your TMJ makes when it opens wide and dislodges the disc. For some people, this can be an ongoing issue for their whole life. For others, it can start once and go on for a long time. Then for others, it can be a one-time thing. The dislodging of the TMJ disc can also cause pain when this happens, though for some people, there is no pain associated with the popping at all. It just depends. If you're very unlucky, there's a scary moment for some people because once in a while, their jaw will become locked. Now, this happens because this disc once again becomes severely displaced and it will need to be popped back into place if that happens. Now, for some people, this is an ongoing issue and they're constantly afraid of yawning and opening widely to eat. Yet for some, it will be just a one-time thing that happens and they'll likely not have that ongoing issue. But it is definitely a sign of TMD when this happens. Now, let's move on to another mechanism of TMD symptoms, which is jaw joint inflammation, not muscle inflammation that we covered earlier. The dislodging of the disc that we just explained will generally lead to TMJ inflammation. However, they are two separate mechanisms because the TMJ disc does not need to be dislocated to cause inflammation in the jaw joint. If your body senses trauma or irritation to the jaw joint, like everything else, it will start the inflammatory process. And remember how I said earlier in the video, nerves do not like inflammation? Well, you have a lot of important nerves leading to your ear passing just by your TMJ capsule. And you can see the hole where those nerves travel and how close they are to the jaw joint by looking at this skull here. If those nerves become affected by inflammation, you may get weird hearing symptoms like ringing or tinnitus or even reduced ability to hear. Also, you may just get pain in your ear. With TMJ inflammation, all of these or none of these are possibilities. But once inflammation starts in the TMJ, it can lead to even more popping of the jaw as well, as now the inflammation is disrupting the natural movement of the jaw and creating other problems within it. In fact, it can become so disruptive that it actually prohibits the jaw and mouth from opening, or at least opening wide. The inflammation just doesn't stop movement though. It may also throw off how the jaw rests or settles when it closes down and bites. People will often express that they feel like their bite is off or not natural anymore when their TMJ is inflamed, because a little inflammation will just throw everything off with the bite. TMJ inflammation, like jaw muscle inflammation, can also cause headaches and pain upon chewing and biting. So you can see inflammation in general just sets off lots of symptoms everywhere. Now, if you have TMJ capsule inflammation or the disc dislocation for too long, this leads to another possible mechanism of TMD, which is called disc degeneration. Basically, if the capsule starts to deteriorate, one of the main things you may notice is the cracking sound or a bunch of small popping noises in the jaw when opening and closing the mouth. This phenomenon is called crepitus or crepitation and happens in other joints as well, like the knee is a common spot. Crepitus can be harmless, but also could be a sign of problems in the joint. It happens for various reasons, like roughened or irregular surfaces in the joint, little air bubbles popping inside of your joint, or because of the bones rubbing together because there's nothing separating them. Crepitus seems to be more common with TMJ capsule degeneration, but can happen without degeneration as well. Now that being said, with capsule degeneration, in general, you can get any of the symptoms involved with TMJ inflammation that we have already covered. It should just be noted that problems are much more difficult to improve once you have TMJ degeneration. And all of the symptoms included with TMJ inflammation are possible with degeneration as well. But the problem is they normally are much more intense once things have started to degenerate. And once again, harder to correct at that point as well. Let's now go over the next mechanism, which is called tooth ligament inflammation. Your teeth have ligaments anchoring them tightly to the jawbone. If too much pressure goes onto those teeth, it translates to the ligaments, and the ligaments of those teeth can become bruised and really sore. For some people, it can even make their teeth loose. On x-rays, this can be apparent for some as the space between the tooth and the bone becomes more pronounced, when it is normally very slight and almost imperceivable. Ligament inflammation occurs in teeth more frequently if you're missing other teeth, because when you clench, fewer teeth are distributing the load of the biting pressure. But it can easily happen on anyone, even with this full set of teeth. It just happens that if you're missing teeth, it's more common and more likely to happen. In fact, the pain associated with tooth ligaments is often difficult to pinpoint exactly where it's at for most people, because many teeth are affected by supporting the increased pressure. So clenching pain difficult to pinpoint is often a sign of TMJ. However, if it is just one tooth that has shifted into a bad position and bears more of the pressure, just one tooth can become really sore with ligament inflammation, and that would be easy to locate. So either is possible, but if it's hard to pinpoint, it's just much more likely that it is TMJ related. Okay, now we have covered the main pathways and mechanisms of the symptoms that someone might have. Now in the next video, we will cover what is happening that is setting off those mechanisms. Once we understand what these triggers are and the mechanisms that we covered in this video, then you can move on to the remedies that will hopefully give you relief for each individual that is watching this video. If in Southern California, my dental office is linked to below. Like and subscribe if you have teeth, and let's move on to part 2.